Hi, I'm Dr. Craig Dingman from Elevate Chiropractic. I just want to thank you for making it to this page. You've come here because you're looking for a path, a roadmap, a blueprint, some type of help in order to get relief and reclaim your health. Whether it be from back pain, neck pain, headaches, sciatica, shoulder mobility issues, or maybe even a variety of other conditions that you've not been able to get help from so far. Here at Elevate Chiropractic, for over 20 years, we've helped thousands of people get out of pain, get healthy, and reclaim their active lifestyle. And I'm confident that if you implement just some of the strategies that we go over in this video today, you'll be able to start the process of getting some relief. However, if you implement these principles into your lifestyle on a deeper level, you're going to see how this blueprint can help you transform your health. Get relief, get out of pain, get back to doing the things in your lifestyle that you wanted to do for years, to go through truly a health transformation. The first thing I want to talk about is symptoms. See, most people think that the symptom is the problem. However, this is very rarely the case. You've heard the old cliche, we all have, that it's just a symptom of a real problem. That's usually how it works in the body. The symptom, whether it be pain, which is the most obvious one, or neck pain, back pain, could be shoulder mobility, could be stiffness, could be other things that you haven't even thought about are related to the body pains or joint pains. These things are what I call collateral damage. Let me explain. Think of it this way. Imagine that your body is a house and you had a problem with the foundation in your house. Now, if you left that foundation unfixed, over time, you're going to start to notice symptoms of the foundation problem. Things like floors unlevel, doors that don't close quite properly, windows that get stuck and shift. Those are simple things, but if you left it even longer, over more time, and I know this because we practice in a Century home, you could have cracks in the floor, you could have electrical problems, plumbing problems, eventually windows might just stick shut and not open at all. And you could hire a variety of contractors. You could hire electricians and carpenters, handymen to come in and fix the problems in each of the individual systems. But if you don't fix the underlying foundation by hiring a contractor, having them come in and inspect the foundation, and look at the problem and correct the foundation, you're going to continue to have to repair and replace things throughout your house. Does this sound familiar? Have you gone through this experience with your health where you've had problems that recur over and over and over again, and you treat them and get temporary relief only to have the problem come back? Well, these things are what I call collateral damage. Of course, in this analogy, the foundation is the underlying core problem. So many of our patients have gone through this cycle of treating the symptoms or the collateral damage without addressing the underlying core problem. So what are some core problems that could be affecting you in ways that you realize, like back pain, neck pain, headache, the typical obvious symptoms, but could also potentially be affecting you in ways that you've never connected or don't even realize yet at all? And it might take 1 or 2 or 5 or 10 years for those problems to manifest into symptoms that you can feel. See, that's how the body works. Your body's always doing its best to adapt for you to make the best out of the situation. And things that will accumulate, like prolonged postures, like sitting and working at a desk with a laptop year after year, maybe a car accident that you didn't heal appropriately from, or sports injuries that have accumulated. Maybe just stress in general over time that's built up in the body, and it builds up slowly, and your body's adapting and accommodating, and you don't really realize because it happens so slowly until eventually you get a very serious problem or awakening that presents you with symptoms that you have to pay attention to. You need to address the deeper issue. Whether you address it early, which is more ideal, or later, which is still better than never, these underlying core problems need to be corrected. So what are some potential core problems that you could be experiencing? And then what are some potential solutions that you can use to overcome those core problems? Let's start with number 1. The key one is movement. Your body is designed to move. Lack of proper movement is one of the most significant core problems that humans face. Your body needs to move every single day. So you don't necessarily need to go to the gym, although, hey, I think that would be a great and healthy idea, but you need to move your body regularly and consistently. And I'm going to include at the end of this video a link to another video of me performing my daily joint-to-joint mobility routine. And I'll show you within just a few minutes each morning how you can mobilize every single joint in your body from head to toe and everything in between. That would be a great first step for your blueprint, is to commit to implementing this joint-to-joint mobility routine into your daily life. The second part of movement that's really, really critical is strength. We need to develop and maintain strength on a regular basis, particularly as we age, because we'll tend to lose muscle mass and strength. And one of the best ways to stay mobile and independent as we age is to maintain our strength. Now, again, it doesn't necessarily need to be at a gym, would be a great idea, but there's lots of things you can do with no equipment in the comfort of your home to strengthen and stabilize your spine and your body. There's lots of things, and if you do that, you're gonna notice, if you do it consistently, huge improvements in your quality of health and how your body moves and feels. Core problem number 2 is nutrition. You may be thinking, okay, what has nutrition got to do with my spine and the health of my spine? Well, it has a lot to do with it. Absolutely. You've heard the old cliche again that you are what you eat. Well, your body takes the foods that you eat, breaks them down, and remakes and regenerates and repairs your body using the building blocks from the food that you've eaten. In the process of inflammation, if you've been looking at health and wellness research in the last 20 years, understanding chronic inflammation is a huge contributor to countless health problems. And your foods that you eat are the things, one of the most important or common things that create chronic inflammation throughout the body. So how do we counter this? Well, eat real foods. I mean, if you did nothing else after this video, apart from just begin to eat more real foods, one ingredient foods, chicken, apple, steak, broccoli, and less processed things, eating these real foods is going to have a radical change in your overall health. It's going to turn down that chronic inflammation, and it's going to give your body a much better chance to heal from any damage that's occurring, or even healing from pre-existing damage. When we start with our patients, we talk a lot about nutrition, because if they improve their nutrition and eat more highly nutritious and nutrient-dense foods, they're going to heal a lot faster and get a lot better results. A third potential core problem area would be in our mindset. See, how we think contributes a lot to our overall health and how we experience pain. And a solution to improve your state of mind would be having a state of gratitude, doing daily meditation, being thankful and grateful. All these things will contribute to a healthy mindset, and it reframes the way our brain experiences our pain. Another example would be sleep. We need to be getting a minimum of 7 or 8 hours of sleep each night. Sleep is when your body heals and cells repair and regenerate themselves. If you're trying to get by on 4 to 6 hours of sleep and wearing that like a badge of honor, like many people in this day and age, you might be able to survive, but you're not going to thrive with 4 to 6 hours. You need a good 7 or 8 hours of sleep every night for proper repair and regeneration. It's absolutely critical. And finally, the fourth potential core problem is with your spine and nervous system. And most likely you clicked on this link today because you read the tagline that said, do you want relief from a spine or spine-related problem? Well, we're going to focus a lot today on that because I think that's one of the most critical things we need to address and the most fundamental core problem that we need to fix. So what does your spine have to do with your health? I think for a lot of people, if they don't have specific pain or a problem right here, they don't connect the symptom they're experiencing with a spine-related problem. But the spine is an organ, like many other organs. For example, your teeth. People understand that your teeth need to be maintained regularly. We have to brush our teeth every day, we floss, we get regular polishings at the dentist. If there's a cavity, it needs to be repaired. If we have structural alignment problems with our teeth, we go to the orthodontist and get braces. People have a really good understanding of how their teeth need to be maintained and fixed, but they don't have the same understanding of the spine. Well, your teeth are bones, your spine is made of bones. And your spine needs to be maintained on a regular basis as well, just like your teeth do. So let's look at and address some fundamental core problems of the spine, and we'll look at some solutions to address those underlying spinal core problems. So let's review the anatomy of your spine. If you look from the side, your spine is supposed to have all these curves that make an S shape. So the spine is like a spring. And just like a spring, when it's coiled up with curves, it's very, very strong. But if you pull that spring straight, it weakens. And your spine is the same. If you lose the proper curves of your spine will weaken. Now, vertebrae stack up on top of each other all the way down your spine. In between each vertebra is a disc, and it's full of sort of soft gelatinous material that acts as a shock absorber, but also lets your spine move and twist and bend. And then most importantly, in the middle of the bones of your spine, all the way down the spinal column, is a hole in which your spinal cord goes. And your spinal cord is your information superhighway. It's what connects messages from your brain that travel down the spinal cord and out the spinal nerves, and then those nerves branch and they branch, and at the end of every branch is a group of cells that make something. It could be muscle cells, could be bone cells, could be heart, lungs, liver, organ cells. And this is how your brain communicates with the cells of your body and tells them how to function and heal and repair themselves. And it's also how those cells, when they send messages back up the nerves, up the spinal cord to the brain, those cells tell the brain how they're doing. They give it information about the environment so that your brain can make the next decisions about what your body should do. And there's this information continuous loop between brain and body up and down your spinal cord and nerves that happens every second of every day. In fact, trillions of signals are sent every second of every day, and you're unaware of 99% of it. Your brain and body are just monitoring and doing things that you're completely unaware of. It's this beautiful orchestration that allows you to be you in balance most of the time. So problems can arise if there's anything that causes a disconnect in this system. A disconnect may eventually lead to what you experience as symptoms like pain or headaches, back pain, neck pain. But more importantly, in and of itself, that disconnect in the spine is a problem that needs to be addressed. Very much like a cavity in your teeth. How many people ever had a cavity and in the early stages they didn't even know they had it, didn't feel any pain? Maybe luckily you were at the dentist for a cleaning and incidentally they put the poker in there and felt it, and you could have it filled when it was small. But most times these problems occur for a long time without us even knowing that they're there. In our teeth, same thing in our spine. And when you think about it, if you left that tooth problem unfixed, over time it's just going to continue to get worse. And eventually you're going to have pain, you might get an abscess, you might need a root canal, you might even lose the tooth. And that's the way things happen in the spine. These spinal cord problems that are left unaddressed might not cause you to feel anything or experience any symptoms, at least ones that you connect to it in the beginning. But if they're left for 1 or 2 or 5 or 10 years, that process of degeneration or breakdown is going to occur. And therein lies the bigger problem. One of the most common and significant problems that happens in the spine over time is the spine begins to change shape. It begins to lose those curves and it straightens. And as it does that, as it straightens, it weakens. The spine begins to collapse on itself. And as it collapses on itself, it starts to respond. Your body will lay down new bone as an attempt to sort of try and stabilize a weakening area. That bone is laid down in the form of osteophytes or bone spurs or disc collapse. This process is known as osteoarthritis. It's a degenerative process. So obviously, the best solution is to identify these problem areas first and prevent the process of degeneration by correcting the underlying problem. But if the process of degeneration has already started, then the next best thing is to either slow down or, if we can, stop that process of degeneration from continuing. Now, how do we do that? Well, herein lies the fundamental process of corrective chiropractic care. As corrective chiropractors, our focus is on the spine and nervous system, looking for a core problem, measuring the core problem, analyzing the core problem, correcting the core problem, and then monitoring the changes. I really feel as a chiropractor that testing and not guessing at what is happening is critical. Having objective measurements so that we can determine, number one, is there a core problem, or at least a core problem that is correctable? And number two, is the application of our intervention or applying the blueprint that we're describing today, is it having measurable changes in your health and how your body's working? So if you're seeking help in our office, the first step is to schedule a case review. Now, a case review is an opportunity for every potential new patient to speak with one of our doctors. And in speaking with you, we can learn more about your history, we can learn more about your case, we can learn more about stresses, both physical and traumatic, that have affected your body, your health, and your spine. Once we've gone through that process, if we're on the same page, and only then if we're on the same page, can we move forward to our neurostructural examination process. Now, the neurostructural examination process is paramount. It's 15 different tests that allow us to assess the current state of your health in 3 major components. The first component is structural. We will do a variety of tests to assess the integrity of your spine and musculoskeletal system, to assess for any potential core problems with your alignment and structure. As an example, it is really common in our practice to see patients who have had a core problem identified, undergone a process of correction for that core problem, to see things like the structure of their spine improved, their pain levels down, but also to be experiencing things like changes in the way their body balances its weight from side to side, changes in their lung volume, changes in their blood pressure, all sorts of objective things, physiological markers changing in addition to the subjective reports of pain improvement, increased energy. The list goes on and on. Following the collection of data during your neurostructural examination, one of our doctors will analyze every series of tests. One of the most important pieces of this process for us as a team is to analyze every specific patient's results in every series of tests and compare them to other patients in order for us to determine how much we can help that individual. Once the test analysis is complete, then we will meet one-on-one. We'll go through all of the neurostructural examination results together. We'll explain it all to you, what your results are, what they mean, and we'll make any recommendations we have for you as far as the correcting a core problem at that point. Once you've asked all your questions, got all the information that you need, then you get to decide how you want to move forward in this process of neurostructural correction in our office. At the end of the day, the most important thing is that you get some relief and that you get some help with the problems that have been affecting how you feel and how you live life. But more importantly, you get some help with the problems that have been affecting your health in ways you might not even yet have realized. So if after reviewing your test results and we sit down and discuss your case and we've chosen that we can accept your case because we know that we can help you and you've decided to move forward, we would absolutely love to be able to do that with you. Our whole team would love to help you with that. But if after we review your test results, if we think that we can't help you, we're going to let you know that too right away, and we're going to do our best to point you in the direction to get the help that you need. So whenever you're ready, if you'd like to book a complimentary case review with one of our doctors so we can have some time to discuss your case and see if we feel that we can help you, you can just click that button right down below there and schedule a case review. From all of us at Elevate Chiropractic, I want to say thank you so much for taking the time to watch this video, especially right at the end. Please remember, when it comes to your health, you are absolutely worth it. I'm Dr. Craig England. Have a great day.